a white pillow one like this, that one on the table. Is that, yep. So we support her knees. And preferably even have her lying on one of the adjustable tables and lift the legs up. Because I want her legs where? Higher than her heart, right? So have you ever had any rashes or anything after you had cold on you? Have you ever developed any kind of blood clots? Rashes? No. Do you have Raynaud's phenomenon? No. You know what it is?
Yeah.
Because people will say no. I don't have that. I have no idea. Or you can ask them, do your digits, when they're exposed to cold, get really cold and blue and numb? That would be an indication for cold. So I wet the towel because she's young and she can tolerate it. If I have someone who's older and I'm not sure they're going to tolerate it, I wouldn't do it. Okay? And usually we're talking about a sprained ankle. So I can use the towel itself to kind of hold it on around her ankle. Okay? I usually, if I use an ice pack, I put a little bit of water in it because it adds to the conformity of it and it helps to melt the ice and kind of make it come through cold. And also sometimes with a very tender area, those lumpy ice cubes don't feel so good if it's compressed. You can also do an ace wrap around it just to hold it in place. And all I'm trying to do, I'm not adding any compression, I'm just literally holding it in place. That's okay. So ice, I can do the knee in this position, do the hip in this position. Yes?
When you say older patient, what age?
Well, you'll have to assess their skin. Even if you have someone, let's just say they're 40 and they've had a transplant, they've been on steroids for a long time, they may have paper thin skin. Okay, so there really is no black and white age. It's somebody that has delicate skin. Okay, and you can tell, it usually looks very paperish like. And you know, they may have a lot of bruising and stuff on their skin. So that's someone you're not going to want to do a deep massage to or do anything that's going to provide deep pressure that could possibly cause bleeding or breakage in the skin. Okay. You can also, sometimes with the athletes, you'll see them on the sidelines at a sporting event, and they'll use like an elastic, not elastic, saran wrap like stuff.
One of the pitchers in the dugout will have one kind of plastic stuff.
So it might not even have wet. It's just right on. And depending on where it is.
And it didn't even flinch.
And they're literally walking around with this thing. And then you can just. Okay. How long does it stay on?
10 minutes.
10 minutes? So in general, it's no more than 15 to 20 minutes. What happens that we need to be concerned about if its skin temperature reaches 50 degrees Fahrenheit or below?
Vasodilation.
That reflexive vasodilation, which or Hunting's response, which would actually increase swelling. So we want to make sure. So when the next lecture that I'm going to be giving you is actually going to go over, and I mentioned it in class, but it's in actually a different picture. The sensations that a person generally goes through, generally goes through when you put cold on it. So first it feels cold, and then they may get this achy, and then maybe burning. Sometimes aching and burning is reversed, doesn't matter, okay? Aching, burning, and then they get to this numb stage, okay? That's the therapeutic treatment level. Once they get to numb, we're done, okay? So if it's 7 minutes, we're done. Sometimes with a cold pack, it may be 15 minutes because they're just not as cold. And hopefully now you'll be able to stick your hands in there and grab some and see. But if it's ice, maybe 7 to 10 minutes. But But as soon as they're numb, it's done. And you need to make sure you educate your patients. Some clinics will say, here, leave this on for 10 minutes. Educate them, leave it on for 10 minutes or till it goes numb. And then just leave it on before you go. Okay? A lot of clinics will do that. Okay? So that's cold ice pack. And again, much colder. So, you know, if we're using an ice pack, we may lean to a drier towel versus a wet towel. Depends on the person. Personally, I like the wet towel. It just feels better. Okay? So, Ziploc bags, you've got some ice. Make sure you go through the questions. You want me to take this one?
And sensation too. You should check for sensation before you
Yes,
put on
sensation
a
too.
cold pack, just like the hot pack.
Okay.